Welcome to Hot Topics. My name is Russ Knopp, and I am the owner of Comfort Keepers. At Comfort Keepers, we strive hard every day to help seniors stay independent and live in their homes as long as possible. At Comfort Keepers, we're proud again this year to partner with the Petoskey Regional Chamber of Commerce to bring you Hot Topics. We think this series is important to bring issues that are important to business owners in a timely manner. I hope you enjoy today's presentation. Thank you very much.
Welcome to another Petoskey Strong Hot Topics Focus on Health. I'm Nikki Devitt, president of the Petoskey Regional Chamber of Commerce, and I am once again joined by Dr. Karen DenBesten, the Infectious Disease Specialist at McLaren Northern Michigan. And we are here today to give you an update on the COVID vaccine, as well as the new COVID strain that is making its way across our state at this time. Thank you so much for joining me again, Dr. DenBesten. I appreciate it.
Thanks, Nikki. Thanks, Nikki, for having me.
Well, let's start first and foremost with probably the most critical question that is on everybody's mind. And does the current vaccines that are out there and being distributed through our community and elsewhere work on the new strain, the B117 strain of COVID?
Yeah, the short answer is yes. It should be effective. The B117 strain is the UK variant, and that has been detected in Michigan, and I would assume that that's probably going to become the predominant strain and is spreading through the community. It is more contagious, the B117 strain, than the previous strain that had been circulating. And there is concern that it could be potentially more deadly, a deadly strain as well. But the vaccine has demonstrated good efficacy in the B117 strain. I will point out that nobody's surprised that this is happening. This is what viruses do. They mutate as viruses replicate. There's errors in replication all the time, and they get mutations. So we expect to see mutant strains. All the more reason to get immunized to prevent further viral replication and further mutants from emerging. But for the B117 strain, we have every reason to believe that the vaccine will be effective in protecting against that strain.
And it's the fact that, we talk about, we know that there could be mutations. We understand that not only it spreads, it's much more transmissible, spreads faster. And there could be, as studies are coming in, the risk of it having, a more potent version of COVID as we've been used to it. So while we're looking at the fact that the vaccine is now more important than ever, as we have these strains coming out, also, we have to dovetail on that we already have in our arsenal and have been using masks and social distancing and washing our hands. But is it not more important than it ever has been now to wear a mask?
Well, absolutely. These mutant strains are coming, and they're probably more contagious than the strains we've been used to. Very effective in preventing transmission, wearing masks, social distancing. We all know that. But I think a lot of the things that we've gotten away with before, things that we might consider not super high risk, like going to the grocery store with a mask on, potentially could be, cause for alarm, because things that we used to do, we might not be able to do without contracting COVID. So now more important than ever, just to double down on our mask wearing and our social distancing when these new strains are coming through. We're in a race against time, really, to get all these immunizations out before our next wave of mutant strains comes through.
And that's obviously top of the news, not just in our community, in our state, but across the country, is, vaccine distribution and the importance of it. And we keep preaching patience. We know there are so many people in our population that want to be vaccinated, but they have to get here. We have to be able to distribute them. There is a way it has to be done. It's not like a walk-in clinic where you just walk up, get your shot, and walk back out again. There's so much more to it. So preaching patience and grace and saying, we're working on it, but until you get your vaccine, until your group is up, wear your mask, everywhere now, everywhere. Walk out the door, put your mask on. Unless you are in your home, put your mask on, especially with these, more stringent and active strains that we're finding.
Even after you are lucky enough to get your immunization, you still need to wear a mask, unfortunately, because we just don't have enough of the population immunized right now. It takes time. Someday the masks will come off as we have less and less COVID in the community and as more and more people are immunized. But for now, we need to wear those masks. The other thing we don't understand is that the immunization is very, very effective in preventing you from getting sick with COVID, like 95% effective. So it's a very good, safe, effective vaccine. The primary endpoint in the studies, though, the vaccine studies, was if you got sick or not. What they didn't look at was if maybe you could just be a carrier of the virus after that, but not get sick. So we don't want to be in a situation where somebody got immunized and thought they were, safe, and then got a very, very mild illness and could potentially spread it to others. I don't know if that's happening, but it's theoretically possible. That has to be studied. And as the vaccine trials continue and they look further at the study population, they'll look at that and see if there's viral shedding in these people. So we'll have that answer down the road, but we don't know that for now. So it's now more important than ever to wear those masks and do everything you can to prevent the spread. We're getting there. I have optimism and hope through masks and through immunization. We'll get there. I don't know the time frame on it, but I'm hopeful, that this time next year we'll be talking without masks on for sure.
That would be fantastic. And as we start to see our some of our businesses that have been, tightly regulated for the last, well over 70 days, by the time we open up again, our restaurants are going to do in-person dining. They have incredible capacity restrictions and all other distancing restrictions as they have in the past. So it's, we encourage people to support the economy and do what you can. But again, it's also do it safely. And be smart about it. And, one thing that we've talked about, which is really unique with our restaurants, is, reminding your staff, reminding everyone, you feel even the slightest bit different when you get up in the morning one day, even just, it might be a cold. Don't go to work. Just done. Don't even bother. Don't do it. Don't
go get tested. Yeah.
Go get tested. Don't even that now that we're getting pieces, because there is fear and concern. That with a new strain out that spreads more rapidly, if we have places we can go, is that going to cause us to spike? Are we going to get a bigger spread again and be back where we were in the fall? And, that messaging of we have to be vaccinated, we have to wear masks, but we also have to be smart. We were all hyper vigilant in the spring about it. If anybody sniffled, we all thought, oh my gosh. I think that's time for everybody to kind of take that back into play. And remind yourself wherever you go, whatever you do, that you could be, contagious. And so you have to be cognizant of the fact that, your community members are counting on you to be a responsible person.
Right. We saw what we were able to do in the spring by being super vigilant. We got our numbers down to near nothing for months on end. And then as everybody kind of let their guard down, the numbers went back up. And then we had a huge, huge surge in November around Thanksgiving. Thankfully, our numbers have stabilized and they've come down. We have probably about 5 patients in the respiratory isolation unit right now. That's down from in November, we were running in the 30s. It was exhausting. So I think everybody's feeling pretty confident and pretty optimistic. We're getting immunized, our numbers are down, things are looking good. The governor's talking about opening up to in-person dining in February. But if you think about it, we've got these mutant strains out there, things are opening up. I'm very concerned that we're going to be looking at a third wave. Next time we talk, we'll be talking about the third wave is here as these mutant strains come through. We are really in a race against time to get everybody immunized to prevent this third wave from coming. I'll continue to say it, though, we can do it. We can outsmart this virus. If we are vigilant and smart and have workarounds, we can stay in business. We can do what we need to do. We just need to know how it's spread and be smart, wear the mask, wash the hands, and do activities and workarounds to prevent the transmission. More curbside pickup, less in-person dining. People can still stay in business if they're smart about it.
Yeah. And as community members, you can still understand that you can support your businesses in a safe and effective way and do what you can. Our restaurants proved before they could handle it well into the summer at 50% capacity and they were safe. Now they can do it again at 25, but it's up on our responsibility as the community to help them maintain that and to, you know, support them in all our businesses right now, but in such a smart and safe way. And, you know, I noticed, I don't know about you, we'll kind of tie things up a little bit. I noticed more people wearing masks, just walking to their cars, you know, and it's not a crowded scene anymore in our community because obviously, you know, it's past summer, but I've noticed that more continually, people just, they walk out the door, they put it on, whether they're around someone else or not. And so I think that's a positive thing that we need to take with us, especially as you mentioned, we could be seeing more of these strains.
Mhm. Well, there are more strains. I mean, it's not just the B117. That's the one we're talking about because it's here. And quite honestly, in the United States, we're not doing enough viral sequencing. So we don't know. We don't have a good handle on the situation, how much mutations and strains are out there because we're not looking for them. If you're not looking for them, you're not going to find them. All these are done, the genetic sequencing is done down at the CDC or the state lab, so not enough is being done to understand what our situation is. The other strains people may have heard about are the South Africa strain, the B1351, and that one is a little bit more concerning. The vaccine may not be as effective against that one. We're looking at that very closely. And then the one from Brazil, the P1 strain from Brazil, that's been identified in Minnesota. And that's the one where they're concerned that people can get reinfected with this P1 strain. So that's another possibility that you could have had COVID and now this new strain comes through and you can get infected with the Brazil strain. That's been detected in the United States. And I just read in the news last night, the South Africa strain, they have cases in Georgia and North Carolina with the P1 351 South Africa strain. So they're out there. We just haven't been looking for them as hard as we need to.
And it's my understanding too, from what, when you mentioned sequencing, that that's one of the most important things going forward as we try to combat and, you know, fight this virus at next levels in 21 versus where we were in 20. It isn't just looking at getting the vaccines out, it's sequencing as well, so that we have the ability to know where these are and where the spread is as we can see it, correct?
Yeah, I mean, sequencing is important to know, to have a handle on what kind of strain is predominant in the community, what kind of therapeutics would be of benefit, how effective the vaccine is going to be, how transmissible it is. So we need to have a handle on what's going on. Sequencing is the way to do that. When you just go and get a COVID test, they're just looking for the genetic, you know, with the swab, they're just looking for COVID. It doesn't tell you what strain it is. You would have to send that out for genetic fingerprinting and sequencing to know for sure. And that's something that's done at the CDC or state labs. But that's the way, the sequencing is the way to know what strain you're talking about.
Anything else you want to leave us with today, Doctor?
I think that we need to realize that there's a lot of hope here. We've come a long ways in the past year. We now have very effective immunizations. As soon as it's your turn to get an immunization, by all means, get it. As soon as you have an opportunity to get it, don't wait, just get it. We need to get as many people immunized as quickly as possible to prevent further spread, to prevent further mutations, and to stop this in its tracks. We need to stamp it out. So there is hope with the immunization, and just continue to do what we've been doing to prevent the spread. We can get through this. We are getting through it, but we just need to stay vigilant and get that immunization.
We've made it this far. We can keep going.
We'll keep going. We can do it.
Absolutely. Thank you so much, Dr. DenBesten, for joining us today. And I'm sure we'll be talking again in a few weeks. And I hope we're still on positive terms and making progress like we are right now.